Good morning, good morning, good morning, my happy people. It is 8:45 a.m. in the morning on May the 11th, 2020. Are you guys woke? I thought I'd just give you guys that little punch to wake you up today. Hope everybody had a wonderful, beautiful weekend for Mother's Day. So, you guys, really quick, Dr. Qualls checking in with you. So, COVID-19 cases have surpassed 1.3 million, you guys, in the U.S., around the world. About 80,000 reported dead. The country is slowly reopening, and about 45 states are now rolling back. So, you guys, in this pandemic, please just to continue to take preventative measures that we know about and that we know that will work, such as staying home if you are sick, except to get medical care. Practice social distancing at work and at home. Wash your hands often with soap and water. Remember, we talked about how to wash those hands to you guys for those 20 seconds and to make sure that we're ensure we're washing our hands properly. And clean and disinfect frequently. Touch surfaces often. Get plenty of rest, you guys, and fluids. Eat healthy food and manage your stress to keep your immunity strong. Monitor yourself for symptoms. Wear a face cloth when you guys are out in settings where social distancing is not possible. Symptoms of COVID-19 include, you guys, fever, temperature greater than 100.4 degrees Fahrenheit, okay? Cough, shortness of breath. If you have symptoms of COVID-19, please contact your medical provider to discuss whether you need to evaluate in person or to be tested. If your symptoms are severe, such as difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or difficulty waking up, or bluish lips or face in your lips or your face, please seek the closest emergency room department or call 911 immediately. Any individuals who are sick or exhibiting symptoms must stay home and stay away from others for at least 10 days since your symptoms first appear in at least 3 days, 72 hours, with no fever, without using fever reducing medications and improving symptoms, whichever is longer, you guys, okay? Now, if a family member or close contact develops symptoms, you should stay home for 14 days from the date of last exposure, defined as date family member close contact last had a fever. So you guys got that right. Defined as the date the family member or the close contact last had that fever is when you should be counting down those 14 days. And for any additional COVID-19 questions or support, please visit www.chicago.gov/coronavirus for the most reliable information. And of course, you guys, if you don't find the information that you need on the website, you know, we have people here at the Chicago Department of Public Health that we have a COVID-19 response team that'll get to those questions and get you guys some answers. You can email them at coronavirus@chicago.gov. Okay. Now, you guys, last but not least, Mayor Lori Lightfoot and the Chicago Department of Public Health on Friday announced the Protecting Chicago framework. Now that the city will be using to guide Chicago's reopening process amid COVID-19. The framework is organized into 5 phases, and Chicago has already transitioned from phase 1, strict stay at home, to phase 2, stay at home. So let me give you guys a breakdown, you guys. So phase 1, strict stay at home, limit the amount of contact with others. Goal is to limit interactions to rapidly slow the spread of COVID-19. Phase 2, stay at home. Guard against unsafe interactions with others. Goal is to continue flattening the curve while safely being outside. Phase 3, cautiously reopen, you guys. Strict physical distancing with some businesses opening. Goal is to thoughtfully begin to reopen Chicago safely. Phase 4, gradually resume. Continue staggered reopening into a new normal. Goal is to further reopen Chicago while ensuring the safety of residents. And phase 5, you guys, protect. Continue to protect vulnerable populations. Goal is to continue to maintain safely and safety until COVID-19 is contained. So the city is working with industry-led working groups with input from community-based organizations to determine guidance for businesses when they do begin to reopen. The guidance will be developed around three key areas, including healthy interactions for workers and customers, safe spaces, and working conditions in operations and monitoring, you guys. In addition, the city has established a set of epidemiological factors such as COVID-19 case rate, hospital capacity, testing capacity, and contact tracing. As part of the reopening strategy, the city is also soliciting public input to gauge sentiment on shelter in place and ensure the reopening is phased in a way that eases concerns that residents may have. And to provide your feedback, you guys, residents can visit chicago.gov/coronavirus/ reopening survey to complete a short survey and give your input. If you guys need that information again, please inbox me. Last but not least, to learn more about the city's plans for reopening, you guys inbox me if you want that link. But what's new about around Chicago? Relief for businesses. Mayor Lori Lightfoot and the Department of Business Affairs and Consumer Protection have introduced an ordinance to provide additional regulatory and financial relief to business impacted by COVID-19 by extending license expiration dates, you guys, and deferring the collection of public vehicle payments. A new partnership has begun with Chicago hotels, you guys, as part of the city's latest protective measures to support those fighting the spread of COVID-19. We have some hotels, you guys, that the nursing home workers in Chicago have been diagnosed with COVID-19 can now gain access to the hotels. And you guys, if you want more information on who those hotels are that these nurses can go to, please inbox me. This is also for city employees who've been diagnosed for COVID-19. So they set it up in hotels, you guys, so that you can have temporarily respite to Chicago's healthcare workers dealing with COVID-19 patients. And the rooms at the hotels are available to nursing home workers on a first come and first serve basis. So it's important that you guys, if you need this information, I'm this abundance of information for you guys. All you have to do is inbox me. Yes, it's Monday after Sunday, Mother's Day, and dress down pajama day for Dr. Qualls checking in with you guys. If you don't see me or hear from me, please pray for me. Those of you who can, look for me. Until tomorrow, enjoy your day and enjoy your week. Shabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dabba-dab